What else can you have or suggest to people that are going through pregnancy with back pain, hip pain, etc., that are ways to break their pain cycles and, like Dr. Corin said, avoiding, ingestibles?
Many women that we see that are coming in with musculoskeletal pain from pregnancy are very unsure about the whole process. What can I do that's safe? What can I do that's safe for my developing baby? What options do I have for dealing with this pain without resorting to things that may have damaging effects? 20% of all pregnant women report pelvic pain, and about 50 to 70% of all pregnant women report low back pain at some point during their pregnancy. This can easily be addressed by chiropractic care or massage therapy from a therapist that is used to dealing with pregnant patients. And it can make a huge difference in the quality of life for the patients who have these problems. Over the last 15 years, the research is starting to show more direct correlation between increased activity in the muscles through the low back region and through the pelvis, as well as hypermobility of the joints through the thoracic spine, lumbar spine, and pelvic region. So this is starting to suggest to us that a lot of the pain women are experiencing during pregnancy is mechanical in origin rather than hormonal. So this is something that we can actually start to address. Pelvic girdle pain, as I said, it's much less common than low back pain. It's the one that we find tends to be the worst for patients to experience. It tends to be a lot more worrisome for them and more stressful, because in a lot of cases, the fear becomes, if I'm having pelvic pain, does that mean there's something wrong with the developing baby? So we get a lot of very nervous patients coming in with pelvic pain to their OBGYNs or sometimes into the chiropractic clinic or massage clinics. If we can help the pregnant patients who have pelvic pain that's coming from mechanical origins, it goes a long way towards making their pregnancies more comfortable and alleviating their fears with regards to how their baby's developing and how this pain may or may not be affecting them. Our goal is to take this a step further and start creating truly multimodal approaches to care for pregnant women and getting more involvement with OBGYNs and researchers as well. So getting patients in to see a chiropractor that's specifically trained in pregnancy evaluation can be a great first step, because it lets us steer them towards the proper care for whatever is actually going on with them. It lets us find any musculoskeletal based complaints that we can help with, and it lets us have the opportunity to alleviate those fears that they may have about what they can do for that pain. So both massage therapy and chiropractic care have been shown to be very safe during pregnancy. Recently there's been a number of literature reviews done specifically regarding the safety and efficacy of chiropractic care during pregnancy and looking for any reported adverse events. One thing we're very concerned about is whether what we're doing with pregnant patients is going to be safe for them. So very few adverse events have actually been found in the literature, and those that we have found generally don't affect the pelvic area or the lumbar spine. And for us, that's where the vast majority of our efforts are being focused during pregnancy, because that's where the vast majority of problems are occurring. I see far more pregnant women coming in with low back pain than I do coming in for headaches or knee pain. One extra area where chiropractors can make a significant difference with pregnant patients is with exercise prescription. So we get a little bit of a boost over a lot of doctors, since most of the OBGYNs in Toronto especially are very, very booked. They're very overstretched. We don't necessarily have enough available. They may not get quite as much time with their patients as they'd like. We tend to get repeat visits, which gives us the unique chance to really encourage exercise in our patients, really put together exercise programs that are very specific to their needs and change as their needs change during pregnancy, and to hopefully that way increase the compliance with exercise. This is an important one that we're trying to address, as we do find there's been research done showing about 92% of pregnant patients are told by their physicians that they should exercise during pregnancy, and only 40% report that they actually do so. Most recently, a 2012 study by George et al. Compared standard obstetrics care when given alone to standard obstetrics care when given alongside chiropractic care, which included spinal manipulative therapy, exercise, and education for patients, and showed that pregnant patients with low back pain or pelvic pain who received the multimodal care had greater decreases in pain and dysfunction, both subjectively and objectively. And as well, these patients reported greater decreases in problems with their activities of daily life and greatly improve sleep patterns, which is a wonderful thing when you're about to have a baby that will be keeping you up all night. This really supports the idea of doing a truly integrated model of care. So that's one of the reasons that we are here today. We at the Center for Fitness, Health and Performance are really looking forward to the opportunity to work with MotherRisk and work with some of you guys in the field to start putting together a more multimodal approach for pregnant patients so that they're getting all aspects of care equally and as needed.
The level of collaboration and cooperation between our two professions is, astronomical these days. It's fantastic to see chiropractors not only doing research with people like Dr. Korn. I mean, what a great opportunity that's been for us. But we have chiropractors and medical doctors working hand in hand in hospital settings. I've got Dr. Lisser with me today, and he's one of my partners. He's a chiropractor, but all of his practice is built on facial pain or referred facial pain patients from chronic pain facilities, dentists, orthodontists, etc. And I'm very happy with this, the way that things are going. And as Dr. Korn said, I started 25 years ago, first chiropractor in a medical facility at Avenue Road in St. Clair. And I thought having two medical doctors as new patients the first day was a big thing. But this is fantastic.